Let me start with a question. Raise your hand, mentally, if not physically, if you've ever stood up after a long car ride or after an evening on the couch and felt your legs feel heavy, achy, or tingly, almost like they'd fallen asleep without your permission. Almost everyone in this room has felt that at some point. And for a lot of us, especially once we cross into our 60s, 70s, and beyond, that heaviness isn't just an annoyance. It's a message from the body. I want to tell you about a patient I'll call Margaret. Margaret was 68, active, sharp as a tack, and utterly convinced that her swollen ankles and tired legs at the end of the day were just part of getting old. She'd stopped taking her evening walks because her legs ached too much to enjoy them. It wasn't until she mentioned, almost in passing, that her left calf had been more swollen than her right for a few weeks, that we sat down and really talked about what was happening in her legs and what she could do about it. I'm a physician who has spent years working with patients on vascular health, and I want to be honest with you about something up front. There is no single miracle exercise that will reverse decades of circulation changes overnight. But there is one simple, well-supported movement, one that costs nothing, takes no special equipment, and can be done sitting in a chair, that does more for your leg circulation than almost anything else we can teach you today. I'll share it with you. But first, I want you to understand why it works, because understanding the why is what makes people actually stick with the how. This matters because leg circulation problems are not rare. They are not something to be embarrassed about, and they are absolutely something you have power over. Let's talk about it. 2. Introduction to the topic. When people say poor circulation in the legs, they're usually describing one of two different things, and it's worth separating them clearly because the causes and the fixes are different. The first is a problem with veins, the vessels that carry blood back up to the heart. When those veins and their tiny one-way valves weaken with age, blood can pool in the lower legs instead of returning efficiently. Doctors call this chronic venous insufficiency, or CVI. It's the cause behind most of the swelling, aching, heaviness, and visible varicose veins that people notice, especially by the end of the day. The second is a problem with arteries, the vessels that carry oxygen-rich blood down to the legs in the first place. When those arteries become narrowed by fatty plaque, we call it peripheral arterial disease, or PAD. This is a more serious condition, often linked to the same processes that cause heart disease, and it tends to cause cramping pain specifically with walking that eases with rest, something we call claudication. Both problems become more common after age 60. Both are underdiagnosed because people assume tired, achy, swollen legs are simply what happens as we get older. And both deserve attention. Not fear, but attention. Because your legs are trying to tell you something about the health of your entire circulatory system. Why should you care, even if your legs feel fine enough right now? Because leg circulation is a window into whole-body vascular health. The same processes that stiffen or narrow the vessels in your legs are often happening quietly in the vessels feeding your heart and brain. Taking your leg health seriously is, in a very real sense, taking your heart and brain health seriously too. 3. Medical explanation. The science behind it. Let's talk about what's actually happening inside your legs, because once you can picture it, the solutions make a lot more sense. Think of your circulatory system as a two-way delivery highway. Arteries are like delivery trucks heading downhill, pushed along easily by the force of your heartbeat and gravity. Veins are the trucks heading back uphill, and that's the hard part. Getting blood from your ankles back up to your heart means fighting gravity every single time, for every single heartbeat, for your entire life. To help with that uphill battle, your body built in two clever systems. First, one-way valves. Your leg veins are lined with tiny trapdoor-like valves that let blood flow upward and then snap shut to stop it from sliding back down. Imagine a series of locks on a canal, each one holding the water level so it doesn't just run back downhill. Second, and this is the real hero of today's talk, the calf muscle pump. Every time you contract your calf muscles, they squeeze the deep veins running through them, like stepping on a tube of toothpaste. That squeeze pushes blood upward, the valves snap shut behind it, and the blood is pushed one step closer to your heart. In fact, your calf muscles are so effective at this job that doctors often call them the second heart, or the peripheral heart. Every step you take is, quite literally, helping pump blood back to your chest. Here's the problem. With age, three things commonly happen. The valves in the veins can weaken or become leaky, letting blood slip backward. This is venous insufficiency. The arteries can develop fatty deposits, atherosclerosis, that narrow the channel, reducing blood flow to the muscles and skin. This is peripheral arterial disease. And perhaps most overlooked of all, we simply move less. Less walking, more sitting, means the calf muscle pump, that second heart, barely gets used. It's like having a powerful pump installed in your basement and never plugging it in. Risk factors that speed this process along include prolonged sitting or standing, obesity, smoking, which damages artery walls directly, diabetes, which affects both small vessels and nerves, a family history of vein problems, prior blood clots, and simply the natural stiffening of blood vessels that comes with the passage of time. None of these are things to feel ashamed of. They're simply the factors we can identify and, in many cases, modify. 4. Symptoms and warning signs. So what does poor leg circulation actually feel like day to day? For venous insufficiency, people commonly describe a heavy, achy, or tired feeling in the legs that gets worse by the end of the day and improves overnight. Swelling around the ankles, especially in the evening. Visible varicose or spider veins, itchy or discolored skin, particularly around the lower shin and ankle, and sometimes a restless, crawling sensation in the legs at night. For peripheral arterial disease, the hallmark symptom is cramping or aching in the calf, thigh, or buttock that comes on reliably with walking a certain distance and goes away with a few minutes of rest. That's claudication. Some people also notice legs that feel cold, skin that looks pale or shiny, hair loss on the lower legs, or wounds on the feet that heal unusually slowly. Now, here are the warning signs I never want you to brush off, because they call for prompt medical evaluation rather than a wait-and-see approach. Sudden swelling in just one leg, especially with pain, warmth, or redness. This can signal a blood clot and needs same-day attention. Leg pain that occurs even at rest, particularly at night, or a wound on the foot that isn't healing. These can indicate more advanced arterial disease. And any sudden, severe pain paired with a leg that feels cold, numb, or pale is an emergency. That combination needs immediate care. The rest of the symptoms, the everyday heaviness, mild swelling, achiness, those are exactly the kind of thing worth bringing up at your next routine checkup, the way Margaret eventually did. 5. Diagnosis and medical evaluation. If you bring these symptoms to your doctor, here's generally what happens, and none of it needs to be intimidating. It usually starts with a conversation and a physical exam. Your doctor will look at your legs, check for swelling, skin changes, and visible veins, and feel your pulses at the ankle and behind the knee to get a first impression of blood flow. A very common and completely painless test is the ankle brachial index, or ABI. It simply compares the blood pressure measured at your ankle to the blood pressure measured at your arm, using the same kind of blood pressure cuff you've had 100 times before. A lower ratio at the ankle can suggest narrowed arteries in the leg. For a closer look at blood flow and vein valve function, doctors often order a duplex ultrasound, a completely non-invasive scan, similar to the ultrasound used in pregnancy, that uses sound waves to visualize blood moving through your vessels in real time. In some cases, particularly when arterial disease is suspected to be more advanced, doctors may recommend more detailed imaging, such as a CT or MR angiogram, which give a more precise map of the arteries. but for the vast majority of people with the everyday symptoms we discussed, the physical exam plus the ABI and ultrasound tell us what we need to know. None of these tests are painful, and none require you to prepare for anything scary. They're simply tools that let your doctor see what your legs have been trying to tell you all along. 6. Treatment and management. Now let's talk about what actually helps. And this is where I want to bring back that one exercise I promised you. For venous insufficiency, the foundation of treatment is movement and the calf muscle pump. Regular walking is excellent, but the single most practical, accessible movement I teach patients, the one you can do while sitting at your desk, in a waiting room, on an airplane, or in front of the television, is the heel raise or ankle pump. Here's how it works. Sitting or standing, simply lift your heels off the floor so you rise onto the balls of your feet, hold for a moment, then lower back down. Do this for a minute or two, several times throughout the day. If you're seated, you can also simply pump your foot up and down at the ankle, as if pressing a gas pedal. Each repetition contracts your calf muscles, squeezes those deep veins, and helps push pooled blood back toward your heart, reactivating that second heart we talked about earlier. It's simple, it's free, and the evidence on calf muscle pump activity supporting venous return is well established in vascular physiology. Patients who build this into a daily habit, a few sets scattered through the day, often notice less end-of-day swelling and heaviness within a matter of weeks. Beyond this, other evidence-based approaches for venous insufficiency include compression stockings, which provide graduated pressure to support the veins, elevating the legs above heart level for a period each day, maintaining a healthy body weight to reduce venous pressure, and, when needed, procedures performed by a vascular specialist to close off or remove problem veins. For peripheral arterial disease, treatment looks a bit different, and it's especially important to have this managed by your physician. A structured, supervised walking program is actually one of the most effective treatments we have. Walking to the point of mild discomfort, resting, and repeating, which over weeks helps the body build new small collateral blood vessels. Medical management often includes addressing cholesterol, blood pressure, and blood sugar, medications to reduce clotting risk or improve blood flow. Smoking cessation, which is one of the single most powerful interventions available, and in more advanced cases, procedures to open or bypass blocked arteries. I want to underline something important. Which of these approaches is right for you depends on which condition you actually have, how advanced it is, and what other health conditions are in the picture. This is not a one-size-fits-all situation, and that's exactly why these decisions belong in partnership with your own healthcare provider. 7. Prevention and healthy habits. Let's turn to prevention, because so much of this is within your control, starting today. Move regularly throughout the day. If you sit for long stretches, watching a favorite show, working at a desk, traveling, aim to stand, walk, or do a set of those heel raises every 30 to 60 minutes. Walk when you can. A daily walk, even in short sessions, is one of the best things you can do for both venous and arterial circulation. Elevate your legs when resting. Propping your feet up above heart level for 15 to 20 minutes a day gives gravity a chance to help your veins for once, instead of fighting them. Stay well hydrated, since thicker, dehydrated blood is harder to circulate efficiently. Watch your weight and your salt intake, both of which influence swelling and venous pressure. If you smoke, quitting is one of the most protective things you can do for your arteries at any age. Wear compression stockings if your doctor recommends them, especially during long travel or long periods of standing. And don't skip your checkups. A 5-minute conversation about tired legs at your annual physical can catch something early when it's easiest to manage. None of this requires a gym membership, expensive equipment, or a dramatic life overhaul. It requires consistency, small, repeated actions, the same way Margaret's simple habit of standing and doing heel raises every hour, plus a daily walk, became part of her routine rather than a chore. 8. Common myths and misconceptions. Let's clear up a few things I hear constantly in my practice. Myth: poor circulation is just an unavoidable part of aging, so there's nothing to be done. Not true. While some vascular changes do occur with age, a great deal of leg circulation health is modifiable through movement, weight management, and medical care. Myth: if my legs don't hurt, my circulation must be fine. Not necessarily. Venous insufficiency can be silent for a long time before swelling or discomfort become noticeable, and early arterial disease doesn't always cause symptoms at rest. Myth: crossing your legs causes blood clots. This one is overstated. Prolonged immobility is a real risk factor for clots, but briefly crossing your legs while sitting is not, on its own, a meaningful danger for most healthy people. Myth: compression stockings are only for people who've already had surgery or serious disease. In reality, they're a widely used, evidence-based tool for everyday venous symptoms too, and many people benefit from wearing them well before anything advanced develops. Myth: one exercise session, once, will fix years of circulation trouble. I wish it were that simple. The heel raise we talked about today is powerful specifically because it's repeated, a little often for the rest of your life, not because it's a single magic fix performed once. Accurate information isn't as flashy as a miracle cure, but it's what actually helps you make good decisions for your body. If there's one thing I want you to walk away with today, it's this: your legs are not just getting old when they feel heavy, achy, or swollen. They are giving you real, useful information, and you have real, useful tools to respond to it. I don't say this to frighten you. Quite the opposite. I say it because so many people needlessly suffer through years of avoidable discomfort simply because they assumed nothing could be done or felt embarrassed to bring it up. Please don't wait the way Margaret nearly did. A 5-minute conversation with your doctor, paired with small daily habits like the heel raise we discussed, can make a real difference in how your legs feel and function for years to come. Take responsibility for your health, yes, but take it gently, with patience for yourself, and without anxiety. This isn't about fear. It's about giving your second heart, those hardworking calf muscles, the chance to do the job they were built for. So let's bring this full circle. Poor leg circulation after 60 is common, it is explainable, and in a great many cases, it is manageable. Often starting with something as simple as standing up, rising onto the balls of your feet, and lowering back down a few times, several times a day. That small motion reactivates the calf muscle pump, your body's own built-in second heart, helping push blood back up toward where it needs to go. It won't replace a conversation with your doctor, and it isn't a cure-all for every vascular condition. But paired with regular walking, healthy habits, and appropriate medical care when needed, it is a genuinely evidence-based, accessible tool that belongs in every older adult's daily routine. My hope for you today is simple. Pay attention to your legs, don't dismiss what they're telling you, keep moving, and partner with your healthcare provider to make the choices that are right for your unique body. Healthy aging isn't about chasing miracle cures. It's about consistent, informed, compassionate care for the body that has carried you this far. Give it that care, and let it carry you further still. Thank you.